Iowa's nearly 300 pharmacies face a daunting challenge: help you get vaccinated against COVID-19. Now, not everybody's eligible yet, and even if they were, there's not nearly enough supply. The Iowa Pharmacy Association CEO explains what is ahead.
The Iowa Pharmacy Association represents pharmacists and pharmacies in all 99 counties, and our members have been preparing to be access sites for the COVID vaccine for months. Some pharmacies already have vaccines and are getting it in the arms of eligible Iowans, while others are still in that preparation mode and making sure that all systems are ready and to go for when they do have vaccines to provide to their communities and to their patients.
But primarily speaking, at a pharmacy, you have a pretty good idea how many aspirins you're going to sell this week and how many are coming in on the truck for next week, right? When it comes to vaccines, it's so uncertain what the supply is going to be, though, right? So how do you adjust that and how do you make plans for that?
That's a great question, and that has been tricky, just as Iowans have been patient and in some cases anxiously waiting for the vaccine. Vaccine providers, including pharmacists, are also having to be nimble and adjust as vaccines become available. One thing pharmacies had to do to prepare was implement an appointment scheduling system. Many Iowans are used to receiving a flu shot, for example, at a pharmacy. And in that process, you just walk in and you can fill out the forms and as soon as available, receive your flu vaccine. In this case, it's very different. And most pharmacies have appointments, and that's based on how many doses are available. And it's also to ensure that social distancing can take place and monitoring can occur after a vaccine is given, and that there's not overcrowding in a pharmacy for the COVID vaccine.
In the absence of a current statewide website or statewide calling center, are these pharmacies individually capable of handling all of this on their own?
We know that the healthcare system, including pharmacies, public health departments, health systems, are just being inundated with phone calls. Pharmacies have done their best to update websites, update social media, collaborate with their county health departments and other providers in the community so that consistent information can be found online, but also by calling in, having pre-recorded messages with information whether or not their pharmacy has vaccine, how to schedule an appointment, or in some cases, how to get on a notification list for when more information is available.
Some of the pharmacists and clinics have talked about the struggle in that once you get, this limited vaccine in-house and you set up appointments with people, if somebody's a no-show or a cancellation, whatever it is, the clock is ticking here because once you open that vial, you only have X number of hours in the time that it has to be used, right? So how do they handle that?
In the pharmacies that I've talked to, they handle that by outreaching first to their patients that they know are eligible. So within a pharmacy, of course, they have their patient records and they know who's over age 75, over age 65, and they can reach out to those individuals if there ever is a dose. Pharmacies that we've talked to have efficiently been administering vaccines and ensuring that no doses are wasted in the state.
In some of the smaller communities in particular, there has been a lag in some cases on a countywide level of once they receive the vaccines, then administering them. Where will the pharmacy's role be in helping to alleviate that?
Pharmacies have tremendous experience in managing inventory, providing vaccinations. Back to the H1N1 pandemic, pharmacists played a tremendous role in providing those vaccines for the H1N1 influenza. And pharmacies are prepared that when doses are received, they'll have appointments scheduled and get those vaccines either within 24 hours, 48 hours, days from when they receive it to vaccinate their patients. It might be on a weekly basis as well. We know some pharmacies in the federal pharmacy program are scheduled to receive just 100 doses a week. So we're not talking about a tremendous volume of vaccine at any one pharmacy. So they may schedule those 100 doses throughout the week to ensure consistency and be able to space them out.
Need that vaccine. Up next, the speaker returns for the Insider's Quick Six and the question about his future.